You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial plastic surgery. With us, we have an expert on the topic, board certified in otolaryngology with extensive training in facial plastic surgery, Dr. Stacey Silvers. Dr. Silvers, welcome to the program.
Randy, thanks for having me.
Now, we've had you on the program before. Great guest, by the way, on minimally invasive facial rejuvenation. Today, we're talking about facelifting. First, though, let's talk about your practice. I guess you're in Manhattan.
That's correct. I have an office on Madison Avenue, and I still practice sinus surgery, which is part of ear, nose, and throat surgery. And I do a lot of facial plastic surgery. I have an operating room in my office where we do a number of surgeries, facelift surgeries, rhinoplasties, endoscopic brow lifts, endoscopic mid-face lifts, upper and lower eyelid surgery, and of course the minimally invasive plastic surgery that we talked about last time, including facial fillers and Botox.
Now, are the patients coming in for facial surgery, are they getting younger and younger, older and older? Is it a mix?
Well, as you know, population has changed. We've gotten smarter. People are smoking less. People are exercising. They're eating better. So I think people are requiring surgery at an older age. But they're doing more and more procedures at a younger age. They're having Botox and fillers at a younger age, trying to have the fresher look at a younger age. So the surgical procedures are often required at an older age.
Now, your background and training, impressive. Voted, I guess for the last 5 years, one of the top physicians in America, surgeons as well.
Thank you.
And you went to Boston University. In fact, I should have you tell the story.
That's true. I did my medical training at Boston University, and I did my residency at Albert Einstein College of Medicine in the Bronx. I've done mini fellowship training in areas of facial plastic surgery, and I've learned a lot of the newer techniques in facial rejuvenation surgery.
Now your board certification in otolaryngology, head neck surgery, does that give you an advantage?
Well, certainly I think it does. I mean, our training is very extensive in learning the anatomy of the head and neck, learning the anatomy of the muscular systems, learning the anatomy of the deep tissue planes of the face, the nerves, the arteries, the vessels, and that is very, very crucial when you're doing this type of surgery.
Okay. Now you say people are coming in now to get a facelift. At what point does somebody, I mean, what do they tell you on the consult? When do they decide to do something about it?
You know, I think it's a very individual thing. I mean, patients come in, they're always scared. I mean, patients who know people have had a facelift are those patients that are afraid. Because typically when people see people who have had a facelift and they know they've had a facelift, it's not a good facelift. I mean,
that done look.
That done look is what makes people afraid. And that's the look we are not trying to achieve. We want to achieve a very natural type of a look with a facelift.
Can you do a facelift where people don't know? Because I told you off camera, I pride myself. I feel like I could spot a facelift, 10, 15 yards away,
not
at
my
least.
Facelift.
Not yours. Okay, and you brought some photos.
I did.
And in fact, I haven't even looked at them yet. But on the consult, I mean, do they say, I mean, everyone just wants to look younger. Is that right or not?
Most patients want to look younger. They want to look like themselves 10 years ago. I mean, that's a realistic expectation.
Really? Okay.
They don't want to look less tired. Oftentimes patients will say, everyone's telling me I look tired. I just got back from a vacation. I look tired,
Right.
which is often a typical complaint. Another concern patients have in the workplace. People are concerned because as they get older and older, it's more difficult to have jobs and maintain jobs or even get jobs. A lot of patients want to maintain a younger age. They
want to be able to compete.
Absolutely.
Do they tell you that on the consults?
Always. That's
really?
a very common complaint.
And men and women, by the way, are you getting still more women than men?
I find that complaint more often in women than I do find that in men.
Now, I've been told in New York, you're known as a go-to person for a natural-looking facelift. And your best work, of course, goes unnoticed. Is that right? That's
the most important thing. You want to look natural. Patients who come to me with photographs of supermodels and they want to look like them, that's unrealistic, and I'll refer them to someone else.
But giving me the inside scoop here, okay? When you see that done look, anticipating this interview, I've been talking to a lot of people about this, but when you see that done look, is that in the hands of the surgeon most of the time?
All of the time.
All of the time?
If you're pulled too tight, if you see big, thick scars, that's not the patient's asleep.
I always feel like it's the healing process, though.
Absolutely not.
It's in the hands of the surgeon.
Who say, I scar easily. They don't scar easily. The doctor closed poorly, and that's why they scar poorly.
Today's topic, we're talking about surgery. natural results, keys to a natural looking facelift. So with the brows, tell me what you do for the brows and we'll move down the face.
Again, in situations where the brows are coming down, and it's also very important, patients are afraid of a brow lift. They're afraid of that surprised look.
Yeah.
So good education and a good consultation with the patient is very important.
So is it tricky? I mean, not to go too high, because I feel that's one of the things. We've all seen that high brow look.
Again, that's an over-aggressive pulling, and it's not necessary. So a good education to the patient about a repositioning, about what is done, showing the patient that they don't have to have extensive scarring, that the incisions are not noticeable.
With endoscopic brow lift, some physicians will say the problem with endoscopic, they fall, they don't last.
If it's done right, it lasts longer than any other lift in the face because it's the least active area.
So when I hear that from a physician, in your opinion, they just don't know the right technique?
They may not have the best technique, and they may, in their hands, do better with a coronal lift.
What do you do for bags under the eyes?
Randy, bags under the eyes are created because, again, gravity is pulling the muscle layers down. So what it's doing is thinning that orbital muscle and causing the supporting fat of the eye to start to bulge through. That's going to create those bags. So what I do is resuspend that muscle, elevate the muscle, remove just a little bit of the fat, and bring the rest of the fat back in and put it back where it used to be.
Back to the facelift, though, these new weekend lifts or 72-hour lifts, and there's a lot of different names, even national advertising on these, these smaller facelifts. What is your opinion?
I think for patients who need very little done, you can get away with these very small, quick procedures with very small incisions.
You do those too, as well?
Most of what I do are traditional facelifts.
Okay.
Okay? And that's what hasn't changed in the last 20 years. I mean, a good facelift has been around for 20 years.
So what defines it? I mean, what is it?
What defines a facelift is the elevation of the muscle layer that has fallen, and that's the superficial muscle layer of the face.
So where do you put the incisions? So we're talking about picking up the face.
Where the incisions are made, both in front of the ear. In women, we're able to hide the incisions, and I'll show you that in some photographs.
Okay.
Part in front of the ear, a little bit hidden behind parts of the ear, and then in back of the ear and back into the hairline. And again, if they're done right, and the incisions are not pulled too tight, and the face is not pulled too tight, the incisions can be camouflaged, and they look natural.